So, hello, I'm Dr. Naomi Sutton. I'm one of the consultants working at Rotherham Integrated Sexual Health. And this little video is just to explain a little bit about how we want you to be doing the gonorrhea and chlamydia swabs in the community. So first of all, I think it's really important to understand that gonorrhea and chlamydia are really common and can be there without any symptoms. So that's the reason that we encourage screening, is because nobody knows if you've got a sexually transmitted infection unless you test for it. Very easy to test. So with women, we suggest a vaginal swab, and for men, it's a wee in a pot, and I'll show you those later. What we really would encourage you to do is, if your patient's there in front of you, get it done rather than give it them to do at home. So all you need is for them to go to the toilet and do it themselves, and then if you parcel it up for us and send it in, then at least we know that it's been done. They're really reliable tests, incredibly accurate. With regards to window periods, a window period is basically from the time when you had the sex to the time when you did the test, until we can definitely say it's accurate, is 2 weeks for gonorrhea and chlamydia, 7 weeks for HIV, and 12 weeks for syphilis. But what I would say, if someone's there in front of you, test them whenever the sex was, and then repeat it depending on the window period and the need. So I will show you the tests. So I'll first show you the vaginal swab. So it arrives in a packet like this. I always open it for the patient just to explain how to take it. Obviously, I'd just send them to the toilets like this, but just for your own learning, this is what the swab looks like. It's a cotton bud on the end. That needs to go into the vagina. It doesn't matter if someone's on their period, or it doesn't matter what stage of the cycle they are, it will still pick up the DNA. That goes into the vagina, move it around a few times, and then this lid needs to be taken off. The swab gets popped into the bottle, and then it self-snaps off and put the lid on. So really important things to say to the patient is, do not pierce the lid and don't spill the fluid. So they're the common things that people do. And then obviously it's really important when they come back to make sure that this is labelled properly. So that's the vaginal swab. These can also be used for throat swabs and rectal swabs. There are videos of how to do those on our website as well, but in essence, it's the same process. For a man, we'd always suggest sending them off to the toilet to do the first pass of urine into a sterile container. It has to be the first bit of urine, and ideally they should have held their urine for at least an hour before they do that sample. And then to pop it ready for going off to the lab, these packets come with a pipette. So if you just open up the sample that they've given you, pipette some up, and then this lid comes off. And you need to fill the urine up to in between these two black lines. And then once that's done, pop the lid back on. Obviously, again, label it up. So this is just an explanation of how to fill out the form. It's really important this is done correctly, otherwise it will all be discarded. So really essential things to put in are obviously the demographics. So first name, last name, date of birth, current home postcode, whether they're male or female or other, and the date of the text. If you can fill in sexuality, make sure this is ticked so that they can get the results via text. Once this is sent, we will deal with all the results. We'll follow them up, get them treated as necessary, and let them know the results. So once this is gone, your job's finished. Make sure the address is on, the phone number, and make sure you tick so that we can actually contact them. It's really important if you can just write where you're sending it from, and the type of sample, so whether it's a urine or a vaginal. The next thing to make sure that you do is to fill out this section, and this bit goes directly onto the bottle. So this just peels off like that, and then just pop it onto the bottle like that, and then that goes back in the bag and gets posted off. So this bottle or specimen goes in there. You take that off and then seal and then post it back to us. So in a nutshell, If you have a patient in front of you, don't let them go home before you've done it, because often we don't get them sent back. So if someone's in front of you, please send them off to the loo and help them do it, get it back to us. Really accurate. Nobody knows who's got a sexually transmitted infection unless we're testing for it. So if someone's having sex, get tested. The other thing, if people want HIV and syphilis testing, there's a link on our website and they can get home testing kits from SH24. So please direct them to us, to our website. And if they've got any other problems or questions, obviously they're more than welcome to come and see us in clinic.